Okay, we are live. Good afternoon, everyone. Today's session is going to be really helpful and is led by Dr. Aparna Jha from Apollo Cradle and Children's Hospital. She's going to talk about why do Indian pregnant women often suffer from vitamin D deficiency and what are the symptoms. So stick around until the end and ask us questions if you have any. Doctor, you have the stage.
Thank you. Good afternoon, my listeners. I am Dr. Aparna Jha, working as a senior consultant gynecologist in Apollo Cradle, Brookfield, in Bangalore. Now, we've been having a couple of sessions from last couple of weeks about vitamin D. Uh, there has been some things which have been already discussed. Few things which I want to highlight today is this: that why are we worried about vitamin D deficiency, and what is it so peculiar about Indian females or Asian females to have so much of vitamin D deficiency. To give you a a background, vitamin D deficiency in India is, as of now, at this point of time, they say that 90% of the females or 90% of the population, especially female population, is deficient of vitamin D. Why so? I will get into it in a bit of the later time of the talk. Some things which are the basic things which I want you to understand is that vitamin D is a fat soluble vitamin. So we have two types of vitamin in our food or whatever, like A, B, C, D, E, K. All these are the vitamins. Amongst them, some of them are fat soluble, like D, E, and K, and some of them are water soluble, like A, B, C. Now, these vitamins, sorry, B and C, vitamin A is also a fat soluble vitamin. So, these vitamins which are fat soluble, they are the ones we see more deficiency of, or they are the ones we also want to monitor the values because they may also get towards hypervitaminosis or excessive of that particular type of vitamin. So coming back to vitamin D, the normal regular range of vitamin D, which can be easily checked by a blood test, a serum vitamin D3 level, what we call it as, it is normally above 30 till 50 is considered normal. 30 to 50 nanogram per dl is considered normal. Anything below 30 but within 20, like 20 to 30 range, is called insufficient. Anything below 20 is called deficient, or anything below 10 is called severe deficiency. Now let's get to the point that what all are the sources of vitamin D? You'll be surprised to know that a part or a large part of vitamin D is produced in our own body. Okay, so there are exogenous vitamin D sources and there are endogenous vitamin D sources. Exogenous vitamin D sources, as we all know, one of the rich source is sunlight. Uh, uh, Now, it depends on what is the exposure time of the sunlight on that, and it depends on a couple of more things. But then, sunlight is one of the major source of vitamin D intake. The other sources like seafood, especially blue fishes, algae, these kind of things are very rich in vitamin D. And egg yolk is another regular source of vitamin D. Other than this, the nuts and the vegetarian sources like nuts and milk and all are also there, but they are not very rich source. They are a bit of poor source of vitamin D. Okay. Now the second is very importantly endogenous vitamin D, the one which is produced in our body. Now, how this vitamin D is produced in our body is when there is a sunlight exposure and it falls on you, especially the UVB rays, when it falls on your skin, the skin produces the vitamin D with the help of parathrombin hormone and calcium, and there are a lot of metabolism which are happening, which produces vitamin D. Now, when we know that the vitamin D is produced in our body, then why we are worried about the deficiency of vitamin D? Why? Because of these certain factors, wherein I was talking to you that why Indian females are or Asian females are more deficient into vitamin D. The very, very important factor is the darker skin, as we consider ourselves as a in our body melanin synthesis is more, and so our skin color is much darker than the western population, And because of this, when we require the sun exposure to us for making the same amount of vitamin D, it is almost 3 to 4 times more sun exposure is required, sun ray exposure is required for us to make the certain amount of vitamin D. Like if a Western female is able to uh, get 1 to 2 international unit of vitamin D formed in her body in 1 hour of sun ray exposure, the same amount I would take around 3 to 5 hours to produce the same vitamin D. So you understand that such vast difference. So that is because of the melanin synthesis in our body more, and that is because of the darker skin. So that is one of the reasons why Indian females are more deficient into vitamin D. The another reason is that we are, though we don't have such fair skin, but we all love fair skin, so we tend not to expose ourselves to sunlight. We tend to remain in indoors more. We tend to avoid sunlight, and even if we get exposed to the sunlight, we've been told from everybody, from all the cosmetic companies and everywhere, that we should apply a sun protection factor sunscreen, which is as high as possible. Now, the sunscreen, which has SPF for more than 30 or so, it just cuts down the UVB rays. And because of cutting down of that UVB rays, your body is not able to synthesize the vitamin D. So that is one of the most important reason why we are so deficient onto vitamin D. The another reasons are aging skin. As in how the skin ages, the capacity of skin to produce vitamin D becomes lesser and lesser. Similarly, damaged skin like a burnt skin or a scarred skin, which is there in, like, if somebody is having more than 50% of burn or so, will definitely produce less of vitamin D. The another very important reason is obesity. If a female, or if anybody for that matter, is more obese, the vitamin D which is already produced, that gets sequestrated, or that gets stuck into the peripheral fat, which is not being able to utilize in the body. So obesity, even if the obese person is able to produce the vitamin D, is not able to use the vitamin D in his or her body. That is another reason. The furthermore reason to add upon is, as when I told you, the exogenous sources of vitamin D is seafood. Now when I'm talking about the seafood, I'm really not talking about those small fishes which we tend to eat more in India. First of all, seafood, we do not eat it in that way, and when we eat also, we eat it properly cooked seafood, or we tend to eat smaller sea fishes more than the bigger ones, when the fat of the sea fishes or the uncooked seafood is having much more amount of vitamin D, which is, when it gets cooked, it gets destroyed. So these are all the reasons why we have vitamin D deficiency. Another important reason is the environment. The polluted environment acts as a sunscreen for UVB rays. It does not let the UVB rays cross through completely the zone and get into our skin. So these all are the reasons why Indian females are more and more deficient about vitamin D. Now let's see what happens with vitamin D deficiency. So what happens with vitamin D deficiency? One is, I'm sure most of us are aware of, is the skeletal tissues disorder or the connective tissues disorder. So if there is a major deficiency of vitamin D, it may cause all the epidermal tissues disorder, like skin dryness, skin diseases. It can cause like bone weakness, teeth weakness, cartilage weakness, all these. So these all are the known facts which we see most of the time. So if there is an extreme of vitamin D deficiency, it can give rise to osteopenia, osteoporosis, the skin quality goes bad, the dryness of skin comes, cartilage, they become ligaments, and cartilage, they become weak, and you are prone for the patient, the severe deficient vitamin D patients are prone for a lot of fractures or the bone pains, what we call it as. Sometimes even the blood quality, the carrying capacity of the hemoglobin carrying capacity, or oxygen carrying capacity of the blood reduces with severe vitamin D deficiency. These were the These are the disorders which are skeletal related or the bone related disorder. Now there are some non-skeletal disorder also which are common in severe vitamin D deficiency, like the patient is more prone for allergic reactions, bronchial asthma, seasonal flus, eczema, like itching or urticaria, what we call it as. All these are related to vitamin D deficiency. For gynecologists, or from our perspective, my department perspective, infertility rate increases a lot with severe vitamin D deficiency, be it in male, be it in female. In both the ways, the sperm quality and the egg quality reduces with vitamin D deficiency. In pregnancy, there are multiple things which can happen with severe vitamin D deficiency, like the patient is more prone for higher BP, what we call it as preeclampsia. The patient is more prone for preterm deliveries. She's more prone for accidental rupture of membrane or PPROM, what we call it as. The babies are more prone for having, the mothers, because of all these things, the mother is more prone to have an IUGR baby or intrauterine growth retarded baby, which are also called as low birth weight baby. The chances of mother developing sugar goes a little higher when we are talking about a severe vitamin D deficiency. Now, this is about the in the mother, in the fetus, as I told you, or in the baby. When the baby is born, it is obviously a little low birth weight baby. The baby's capacity or immunological capacity of the baby is much compromised in from the mother who is born from the in the baby who are born with vitamin D deficient mother. The And because of the immunology being very low or immunological disorders being higher, those kids or those babies are more prone for respiratory tract infection, and they are very prone for catching cold, cough, and very very common seasonal flu, ear infection. All these are much more common in those babies who are born by the mother who's having vitamin D deficiency during her pregnancy time. Childhood asthma is a very common thing which happens. These all I'm talking about things which are apart from bone disorders. Of course, the child who is born with a severely deficient vitamin D mothers can have a bone disorder like osteomalacia or osteopenia or osteoporosis. Breakage of the bones becomes very common. Fractures become very common. So those are extreme cases. But the one which I'm talking to you are all those day-to-day life cases wherein we see because of vitamin D deficiency, the baby is falling sick quite a lot. They are prone for, and they when they are sick quite a lot, obviously there are much and much more antibiotics or much more steroids are used on those babies, and they in turn keep losing their immunity. So it is important to define, or to rather diagnose, vitamin D deficiency in the mother when she is carrying. And if there is a vitamin D deficiency into the mother, that has to be definitely treated during the time of pregnancy. And if it could not be treated during the time of pregnancy, or even if it was treated, the kids, the babies who are born, so first 6 to 8 weeks, the baby has the vitamin D which is being given to him or her by the mother. But after that, the babies or the kids should be supplemented with vitamin D drops or syrups, as in how the age of the baby comes. Now, the WHO recommends for the developing countries and for the Asian countries or the dark skinned people countries, WHO recommends 2,000 international units of vitamin D on daily basis or more if at all there is a deficiency. So depending upon how much is the deficiency, depending upon what is the situation, the vitamin D can be supplemented. So I would suggest my listeners to to have it a little. To get your vitamin D check done, and if you're deficient, please make sure that you have been given supplements for the vitamin D so that we can cut down on upon lot of complications of it. Thank you. If there are any questions, I'm ready to take it.